can you please tell us your name and your position here?
Yeah, my name is Michael Rossinello. I'm a critical care specialist and pulmonologist. I'm the director of the critical care unit at St. Clair's Hospital in Denville. Been the critical care director for approximately 8 to 9 years.
My name is Vivek Agnihotri. I'm the staff nurse here in critical care unit for the last 25 years.
My name is Abraham Solomon. I'm a pharmacist here about 2 years now.
How do you think that CPOE has improved patient care?
Well, we went live with the computer system in 2006. At that time, most of the information we got was results, and I think that in and of itself has made life easier, because now we have access to charts, we have access to labs. I can see them anytime I want, and compared to previous hospitalizations. I can order medicines, and there's drop-down menus. I don't really have to look up dosages that I didn't remember from before. I can always right-click and get a reference on the medicine if I don't know it. So it does make my life easier from that point of view.
The barcoding, I think that's an excellent idea. It's a patient safety issue. So I think no matter how tedious the job is, but it's a patient safety concern. So I think medication errors don't reach the patient at all. So that's an important goal for us as far as medication safety goes.
Everything's in real time now, so if there's ever any issue, when the doctor puts it in, within a couple seconds I can call him. He's still on that floor. If there's any problem with the telephone order, I can speak to the nurse right away. I know what's going on, and everything's in one place between the patients, you know, what they take at home and what the doctors are putting in. And not only that, it's gonna make it even better for patients, because now we have the capability to decentralize the pharmacy when it's appropriate in the future. We can go up on the floors and follow up with what they're putting in, you know, before they even do that. If they have any questions, pharmaceutical related questions, we can answer it before they even put in the order.
How has CPOE changed your day-to-day?
I think it's basically streamlined the whole process, and we've been saving, you know, first and foremost, resources, hospital resources. We don't use the fax anymore. We're not tied to it. Obviously, we're working out all of the quirks and things of that sort, but it's definitely a lot better. I mean, it's improved things. It's even improved the quality of life in terms of working down here in the pharmacy. So things are better.
As far as CPOE is concerned, I think it's made it easier because I'm able to access it from home. So I spend about 10 to 15 minutes after I get home at night, probably after dinner, to plan for the next day. We can get into the system through a portal from home, and then I could sort of plan my plan of attack for the next day. I can order a blood gas or a chest x-ray that maybe I forgot to order from the day before, and that makes it easier because when I come in the next day, those things are done. So from that perspective, it's made it easier. Sometimes it's a little bit more difficult because if I'm not at a computer, if I'm driving in my car, or if I'm at a restaurant, then I don't have access to the computer. While I can go on through my smartphone, it's not something that I would want to do. Mm-hmm. But at that point in time, the nurses will take verbal orders. It doesn't change the way that the flow from day to day in hospitals have worked. So I think overall it's made my life easier.
And for our other CHI hospitals who are listening, is there any advice you would give them in terms of their go live? Maybe anything that we could have done differently that would have made things go smoother?
I think that the other hospitals should talk to our IT people. Our IT people had super users and a real good support system. They had 1 or 2 people or more on every floor, so that when we first went live, we weren't paralyzed in trying. It's very important to have super users and people who know what's going on. There's always quirks in the system, and we're changing things every day. And the one thing that I can say about our IT people here is they know who the end user is. The end user is the physician, and they have to make it easy for us to use, or else we won't use it. So when there are problems that come up or things that we think need to be tweaked, they're willing to listen and work that out for us. think that 90% of the time they're able to fix what we need to be fixed
Okay.
to make our life easier. So it's a work in progress.